What is Inobrodib?
So Inobrodib is one of the classes of drugs which are called epigenetic drugs. And so epigenetics are a way of controlling what genes are activated in a cell. And so Inobrod is a molecule that blocks a protein that helps genes get turned on or off. And there's one protein in particular called B300, which is part of this. And so what it tries to do is it tries to modulate what proteins get made in the cell, and by doing that, can you develop an anti-tumor effect? And so the other drugs that are like this, there are things called histone deacetylase inhibitors. There's one that was generated for myeloma many years ago called panbinostat. It's no longer available, but that's sort of the general class in Inobrodib.
What is the dose of Inobrodib?
It's an oral drug, and in general, you take it twice a day. And right now, they're testing at different doses what is its effects and how well is it working.
Are they used as a monotherapy or in combination with other drugs?
The study that's ongoing has been using it both as a single agent, but then in combination with an IMiD and steroids, just like we do with many other drugs. So it's a combination thing. I think people are looking at more in the end.
What population is being studied in the trial?
This is really just like any other new drug in myeloma. They start out in general in patients who have more advanced disease. So people have been through multiple lines of therapy and have been through a bunch of different things. And so this is the population that it's being tested in now.
What are the main side effects of Inobrodib?
I think that a lot of it is things like infection because it does affect the immune system. I think that in general, epigenetic drugs may influence things like I think people get a lot of fatigue from them. And so these, I think, are the things that people are looking out for in these trials.
Are there any available efficacy data for Inobrodib?
Some responses where you see people's myeloma numbers their lab numbers go down with just a single agent, and then there's better data if you combine it with pomalidomide and with dexamethasone. So I think the combination data looks good, but you have to realize that's with drugs that we know can affect myeloma, and so it's a little harder to tell what the contribution of the Inobrod is in that setting.
Is there anything patients need to know about Inobrodib?
I think that if it really makes it through this trial, then it's like the next trial is like a larger trial and a larger population of patients. And so really it is, can it cross this hurdle, be safe for people, have some evidence of efficacy, and then it'll be explored more broadly. And so I think that it's got to get through this one stage and on to the next one. And so I think that if it does, since it is a sort of different than all the other medications we use in myeloma, it gives you the opportunity to think about how do you combine it with other things. And so I think there's a lot of work that can be done if it makes it past this first point.